This video will demonstrate use of a hot pack during occupational therapy treatment. A hot pack is often stored in a hydroculator. It can be filled with a silica gel, and it can have a canvas or plastic covering. To get the hot pack out of the hydroculator, you want to use tongs because the water is hot. Pull it out of hot water, and you can put your hands on the webbing if you'd like. And again, we have, you want 3 to 6 layers between the hot pack and a person's skin. The hot pack works by transferring heat through conduction, and the heat is to adapt between 1 centimeter and 3 centimeters with the hot pack. So let's bring it over here and put it on our client. And this time, let's do it to the wrist, finger flexors this time. And actually, you have to be careful when you put a hot pack on the top of a client, so it might, sometimes it's better, it depends on the weight of the body, to put the hot pack underneath the body so there's not as much weight bearing on the heat, but whatever's tolerable and comfortable to your client. The reasons that you would use a hot pack are to decrease pain and stiffness, to decrease a muscle spasm. A hot pack is very good at increasing tissue extensibility, so that means your tendon lengthens and you get better increased active range of motion and passive range of motion. It can also improve the viscosity of the synovial fluid in the joints and promote healing and relaxation. Some contraindications for using hot pack are if they have more than minimal edema. I would probably not use a hot pack. If they're actively inflamed, if they have cancer at the location where you're applying the hot pack, you don't want to apply heat to a deep vein thrombosis on a pregnant uterus. If they're actively bleeding, if there's an infection, you don't want to do it probably the first 6 to 8 weeks on a tendon or a nerve repair or ligament repair. And as with cold pack, you use caution when you're using it with children and the elderly because they may not be able to understand when it's too hot and they may get burned. My understanding is that there are more lawsuits filed over hot packs application to people than any other modality, not necessarily OT use, but use in the medical profession. And then you don't want to apply a hot pack to anyone that has severe cardiac disease. Other precautions are impaired sensation, decreased circulation, and I would check, especially the bony prominences, after 5 minutes to make sure that it's not too red. If there are any blisters that occur, sometimes with light-skinned people or people who have red hair, they're more prone to blister. So if they're complaining that it's too hot, you would want to put another towel layer, especially over the bony prominences. You want the hot pack to be on the client's skin between 12 and 20 minutes. Check it at 5 minutes. Check with them verbally to see if it's okay, and also physically check, especially the bony prominences. If there's any signs of overheating, then you want to remove the hot pack and apply a cold pack for a couple of minutes to discontinue the heat. And when you're finished with the hot pack, you want to put the hot pack back in the hydroculator, and it takes about 30 minutes for it to reheat enough to apply to a different client. So once you're finished with the 12 to 20 minutes from the hot pack, then you can work on stretching exercises or other, maybe a leisure activity that they enjoy after the heat. For documentation for a hot pack, you want to document how long the hot pack was on, where you applied it to the body, any comments that the client has about its use, and any changes in range of motion or occupational performance after the hot pack compared to when you didn't use the hot pack. And stop.